first, heart rate, you know, you can follow that order. It might just keep you on track, okay? But when you go in, it's okay to kind of do this in like some sort of certain order, all right? I would always start with vital signs. That term covers a bunch of stuff. Vital signs are your heart rate, your blood pressure, your respiratory rate, and sometimes depending on what text you're looking at, SpO2 and temperature. Okay, it covers a lot of information. You gotta know that. Then I go to breath sounds. Then you have your pulse ox, right? You have all the other percussion, palpation that you can do as well. And every single time you walk into a patient's room, what's the very first thing we're doing besides talking to them? Looking at them and inspecting. You know, what do you see? Okay? So now I'm gonna listen. Okay, when you have a patient listen, when you're listening to a patient, you want them to breathe in and out of their mouth. I don't know if you have major allergy issues.
Yes.
Okay, sometimes I get really stuffy noses. You can have nose whistles. Is anyone familiar?
Mm-hmm.
No? Nobody's ever heard a nose whistle?
No.
Or it can just be so stopped up that it's hard to breathe in and out of the nose. So you want them to breathe in and out of the mouth. Okay? Sound good?
Mm-hmm.
All right, here we go. Okay, Jen, so I'm just gonna have you give yourself a hug again. Excellent. And normally the patient's in bed. Okay, so you can have them sit up in bed. You can assist them to sit up in bed. They can use the bed rails to sit up. Okay, and you're just gonna have them lean forward. This is like the perfect situation where I can have my patients stand up, you know, give themselves a hug, but this may not be necessarily what you're seeing in clinicals because the patients typically don't stand up for this, okay? I just want you to be able to see me. Okay, you ready? So you're just gonna take deep breaths in and out of your mouth for me. Let me know if you feel dizzy. Why do you think they'll feel dizzy? They're hyperventilating, right? They're blowing off too much CO2. Slow down. We don't need to pass out here, okay? All right, ready? Okay, so deep breath. Great job. And see how we're going? Side to side. Doing okay?
Yeah.
All right, now I'm just gonna come around to your front. You're doing great. Now, do you want them in your face going like this? No. Okay, so you can just turn your head that way for me. Excellent. Again, one more time, nice deep breath. Doing great, good job. And again, you can come under the armpit if you'd like. One more time. Now, Jen sounds amazing, okay? So that's kind of the difficult thing. And you can just breathe like normal, and you're just gonna feel me tap on your back, okay? Are you ready? And you're listening. Do you see how I'm going from side to side?
Mm-hmm.
Okay, then I would come to the front. Here we go. And I'm just gonna go from side to side. You ready? Excellent. That's it. Have you take a real nice, slow, deep breath in and exhale. Okay, we're gonna do this a couple times. While the patient does that, you're literally looking for that, and you're feeling for that symmetrical movement. If only one hand moves, or moves way more than the other, there is a problem on this side, this long. Okay, you ready? Okay, so here we go. So can you see the butterfly? Can everybody see it? So that you're just doing this, and everyone's gonna practice it. Okay, ready? Nice deep breath. And out. In. And out. Excellent. Very subtle. Thank you so much.